slow to get to his
Right.
lungs.
So therefore,
not
now he's-
through this
now he's
small
getting- yeah.
stented ductus that he's getting bigger.
Yes.
Yeah.
So I'm seeing that he's getting more oxygen through
Yes.
by himself
Yes.
now.
Yes.
Now the feeding, I think the feeding may kind of like trickle a little bit because of the fact that he just probably just being justice. That's what I just say, But I feel like after the surgery, I feel like he should be pretty much clear of the two because then the feeder and everything.
Well, I think it's just going to depend how he does.
Yeah, and see, this is what I'm saying because sometimes he do good, and I've been watching him for like 3 months.
Right. So he should tire less easily.
Yeah,
again,
and then he'll
because
do
his
more
heart
suckling.
is repaired.
And
So
that's
he
what I'm saying.
shouldn't have the struggling because he gets tired. That
Right.
should certainly
Right,
be
and see,
better.
or he'll go to sleep.
Right.
And she
Because
said,
he's tired.
Because he's
Yeah.
fatigued
Right.
and tired.
And
Yeah.
this I
for babies
understand.
with heart defects, sucking a bottle is kind of like us going around
Yes,
a mile.
right.
Like it's hard work
Right.
on that.
Right, and that's why I try to tell her that like she said, okay, feed him at 12. I mean that's all good and everything, but I don't really force justice too much.
Okay.
But I try to do it within that
Sure,
hour time.
Sure. No, I think that's
You know.
good. I think that the speech people and the nutrition people will say, babies who are a little aversive to
Yeah.
eating, you want it to be enjoyable, so we don't want to force them.
Right.
Because eating's supposed to be a good experience,
Yes,
right?
right.
So I think there's a little bit of letting him kind of cue and call the
Yes.
shots on when he really wants to eat.
There you go.
With also then though, like he's got to grow because
Right.
Yes.
they got to have
Right.
babies
Right.
grow.
And
so
I think that's the part
it's
she
a
has a hard
balancing
time.
act
No,
between
but
it is.
I'm just getting a better understanding of it.
And I think that what
Yeah.
we'll do is we'll see how he does afterwards when he's not tiring as easily. His oxygen saturations are more normal. His heart's kind of starting to remodel itself with all that extra muscle because it's not pushing against this atretic valve. And we'll just see how he does.
Yeah. Well, I mean, that's all I'm saying. I mean, because it seemed like to me he wants to. This little boy right here shows me he's a fighter.
Are you a fighter, Justice?
He shows me he's a fighter.
Sure.
That's why I'm saying to myself, if he didn't get tired so bad, he could go ahead and drink that bottle
Sure.
down with no problem.
You're
because
right. And you
because
probably-
now he gets a chance to taste for himself.
Yep.
And say, oh, I done missed this for so long, and I'm just gonna just
Yeah.
gobble, gobble, gobble.
And I think when you find that he's probably has more stamina and is able to do more feeds, that he'll get more in him just because he can
Right.
physically suck a whole bottle without being exhausted.
Yes.
So you should notice that. But then again, he's just been through major surgery, so there's
Yeah.
a little bit of time where it's just he's recovering from surgery before he gets to the point where we can be like, let's see what he can do. Let's see what he can do with feeds, and that's kind of going to partly depend on him and just how things go.
Right.
And
right.
that will also determine how quickly he is able to come home.
Yes, that's true. Yep.
Yes.
And so, when we talked about like the rhythm issues and that delaying time,
That's
part
a
of it
cardiac
too.
standpoint.
But also feeds are part of that too, because nobody on the cardiology team is going to say, well, let's send him home with substandard
Feeding.
intake.
Right,
Right. We
right.
need him to be growing and healthy. We need calories to heal.
Yeah.
So, the whole team, we're very focused on feeds. And sometimes at the very end, everything else looks fine and it is
Except
just
for the
feeds.
feeds.
It keeps them here. So
Yeah.
that would
Yeah.
be something that would make it at the little longer end of an
Yes.
admission if he's just really not wanting to cooperate and we're hemming and hawing on continuing NG versus do you want to just say let's get a G tube? I guess we just don't know. We have to see how he does.
Right. Right.
Have you had any experience? Well, I'm sure you have with babies like him that go in with the G tube or the NG tube, and then
Sure.
they turn
Sure.
around or
Yeah.
they don't turn around.
No, we certainly see babies that their PO picks up and they do better because their heart is repaired.
Okay.
For sure, especially with the help of like some of our speech pathologists and our occupational therapists that can work with you and him. Sure.
Okay.
Definitely, and there's babies that have G tubes who they certainly don't use it forever. I mean, that does happen. It's for a period of time. They're not going to kindergarten with it. You know what I
Right,
mean?
right.
But sometimes babies with defects need one, and sometimes, but having NG feeds at home is another option, kind of depending on the parent's comfort level with it. You obviously were fine with it. You learned
Yeah.
how to do it, and you were fine with managing it.
Yeah.
Some parents are like, no.
Yeah.
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 But she's good at it.
I'm good. I'm just to the point where I'm a little exhausted.
No,
with
I'm
it.
sure. I'm sure. So let's just hope.
And he pulls it out every other day.
Well, they are very good at that. Even babies inpatient with everything taped in their hands with the little things, the little
Yeah,
mitts.
okay.
Even babies, they manage to pull them out. So
And they get the right one too.
they do. They hook a finger around
There you
it,
go, that
boom,
finger.
it's out,
Yeah.
and you're just like, no.
Yeah.
I came from the
Yeah.
bathroom one morning, and he was in his little bassinet just kicking and playing. I said, "Oh, the baby doing just fine." I looked up and looked at Justice, and he looking at me, and he didn't sit there. Just here's a tube sitting up there on his chest. I said, Justice, why did you do that? And he just looked at me, started
He's
kicking
smiling.
like saying, I did it, Grandmama, I
I
did
don't
it.
want that in my nose.
Right.
I don't
Little
either.
pistol. Yeah, I don't want that.
Yeah, other than that, he's a good baby. I
Oh,
mean,
I'm
he
sure.
just shows all the rhythm and
Sure.
you know, he just shows good.
We'll just see how he does. We'll see how he does after. It's really up to him. He's calling
Yeah.
the shots.
Yeah.
With a little help from the team, and then we'll just make a plan moving forward, which you certainly will have a say in.
And that was the issue with getting him home after the the ICN was he was good, but he wasn't feeding, and so that held us up a little bit.
Yeah. So we'll just see how it does. I think it's encouraging that he hasn't had an NG tube in for a week, and he hasn't done terrible.
Right.
I don't
So-
think it would last long. I think we'd start to see that he was losing weight. I don't think that this is all like, great, he's POing perfect, but again, he's not repaired. So
Right.
he does still tire. So I
Right.
think
So
we'll
it's
just have to
showing
see.
that there's definitely
Yeah.
some improvement.
Yeah, I mean, some babies you take it out and they are doing, 10 ounce, 10 mLs.
Right.
They're doing an ounce PO.
Yeah.
That's just not enough to sustain it.
Yeah, and see, the first time he took it out, we left it out for a week just to see how he'd do, and
Yeah.
he lost weight. So this time he took it out, and he didn't lose, but he's not gaining, so that's not so
right.
bad.
Right, no.
Would you suggest putting it back in, being that we're a week out, or what do you think?
Well, I think if he's slowing down that much
To
and
go
that's
ahead
his intake, I would.
Okay.
I would, just because you want him robust for surgery.
Right. Yeah, I don't want him to lose.
You know what I mean?
weight. Yeah.
And if it was tomorrow, I'd say don't bother, but it's not till Monday. It's
Yeah.
only Tuesday. It's almost a week away.
Yeah.
I would.
Okay.
What did he weigh when he was born?
4 pounds, 12 ounces.
And what week were you?
37.
37 weeks. C-section, vaginal,
C-section.
C-section. Okay. We put that in our database on all our babies. Okay. All right.
One
I
more
think-
question.
Yeah,
I'm
no,
sorry.
that's fine. And that's yours to keep.
Okay.
So,
What meds do you think he'll be going home on?
He'll
Is
def- I think he'll-
perfect case, best case scenario.
the perfect case scenario, Lasix,
Okay.
right? Which he's on now.
Is this something he's going to be on forever and ever?
No,
and
not
ever?
forever. But when you do the bypass machine and you have surgery, it adds a little extra fluid, and we need to pull that fluid off.
Okay.
Now he's on it because that blood that goes across the hole and, can actually over-circulate a little bit via the duct in his ductal stent, even though now he's kind of outgrowing that. But you need to be on it so you don't over-circulate your lungs.
Okay.
Afterwards, it's more for fluid that's added because of the bypass machine and the surgery. So he'll go home on some and it will get weaned off. Again, partly with us. We'll probably see him once for a post-op visit, and then we'll have one scheduled with Dr. Whittam, and she'll wean it off at some point.
Okay.
And she'll kind of manage his reflux meds on long term if he needs it, and then aspirin, which he's on. He'll be on that for a bit still. And then we'll have to see, depending on if there's any issues with any ribbons, if they decide to do anything else. But we'll just see. That's not usually as
Okay.
typical.
So typically what he's on right now.
Not that different.
Okay.
And some pain meds if we find that he's needing it. But he probably won't be.
Okay.
Okay.
But he should need oxygen,
I know he shouldn't.
and hopefully he won't need this feeding tube.
Yeah, I hope he's just like a little champ with the feeding when he's done.
I hope so.
So this is the consent. I'm gonna have you go ahead and put your name and cell phone number there, because that's how the nurse in the OR is gonna update you.
Okay. What are you doing? I forget his dad's phone number.
I know. Because all you do is like hit their